السلام عليكم، مرحبا بكم في هذا الفيديو التعليمي. سوف نتعرف على انخماص الرئة الكامل، ما هي أسبابه وكيف نتعرف عليه في صورة الصدر البسيطة والأشعة المقطعية معا خطوة خطوة حتى نفهم هذه الحالة بشكل طبي مبسط. شكرا لكم.
Hi everyone, today we're going to talk about a critical radiologic condition, total lung collapse, also known as complete atelectasis. We will cover its causes and how it appears on chest X-ray and CT scan. Total lung collapse occurs when an entire lung loses its air content, leading to complete volume loss. The most common causes include central bronchial obstruction, usually due to tumors like bronchogenic carcinoma, mucus plugging, foreign body aspiration, severe pneumothorax, especially tension-type massive pleural effusion, which compresses the lung, and post-surgical or traumatic injury affecting lung expansion. Total lung collapse is a serious finding that needs urgent attention. A thorough history, physical examination, and appropriate imaging studies are crucial for early diagnosis and treatment. Radiological signs include volume loss signs such as shift of the trachea or mediastinum toward the collapsed side, elevation of the hemidiaphragm on the affected side, and crowding of the ribs. The bronchial obstruction point can often be seen as well, showing a central mass or mucus plug. Air bronchograms may also be present, depending on the cause. There will also be displacement of the mediastinal structures toward the affected side. CT helps to confirm the cause and detect associated findings like tumors, lymphadenopathy, or endobronchial lesions. It's important to distinguish this from other causes of hemothorax opacity, like pleural effusion, which usually pushes the mediastinum away, not toward the collapsed lung. Chest X-ray signs. On a chest X-ray, total lung collapse shows as a whiteout or opacity of the entire hemothorax. This is due to loss of aeration. CT scan findings. On chest CT, the collapsed lung tissue will appear as a dense, compacted structure. If you enjoyed this video, please like and subscribe for more radiology education. Thanks for watching.